Good morning. This is Dr. Katie from Craig Chiropractic and Kinesiology. And today I wanted to talk about some real-world case studies or cases that I have personally seen as a chiropractor, an acupuncturist, and an applied kinesiologist. So I think it's always nice to hear other success stories that have helped other people, and sometimes they can help us with certain conditions to be like, oh, here's someone else just like me. So I was thinking back to when I was still in chiropractic school, and I'd just become an intern, finishing up the last year of my schooling as a doctor. And I had a rather interesting case. So I was practicing more of traditional chiropractic care, as is taught in school, as well as cross-training in applied kinesiology. And at the time, during one of my internships, this was shortly, I believe, after COVID in 2020. So there were many times that we could not be in clinic. So we had to do telehealth visits, which, as you can imagine, as a chiropractor is rather challenging. So we did visits and did the best we could with our patients, watching their movements, asking where pain was, and basically suggesting exercises and things at home that you can do. Just working with the circumstances until we could get back in clinic. But anyways, I had a patient at this time, a student that I had worked with. And at the time, this student was a power lifter. And they were doing pretty good, but they had a history of low back pain, particularly when they were squatting in the gym. Like, I don't think they felt it as much just doing a normal squat, but especially if they added weight, like if they were going to actually do a full power lift. There was some discomfort there, and I was not aware of it at this time, but I guess their performance was kind of peaking out. They were starting to plateau in the progression of trying to do more and more weight. They were hitting a bit of a plateau there. So I worked with them through telehealth using more traditional methods of rehab and exercises. And we discovered that this individual's psoas muscle, which is a very important hip muscle for things like squatting or trying to go from sitting to standing, we discovered that their psoas muscle was incredibly tight. So I gave them some specialized techniques to do at home to help loosen that up, as that is a hard muscle to stretch on your own. If you have questions about that, I might do a follow-up video for some resources on that muscle. So anyways, worked with this patient. We got their psoas more loose, right? Loosened up, maybe a better way to say it. And they started getting some improvement. Okay, they definitely had a decrease in back pain. It wasn't 100% gone, but it was a lot more manageable, and they felt good about it. So fast forward a couple months after this, I actually ran into this patient, which was a student, at a seminar where we were learning and training in applied kinesiology. And at the time, a lot of times in seminars or doctor seminars, you will pair up as doctor-patient and practice the new procedures you learn on each other, which is kind of nice. And it's under supervision of other doctors, etc., that are experienced in this. So that's how we learn, through hands-on. We were learning and going through things like the hips, psoas, and this individual still dealt with some discomfort and problems with their squat. Like, they were doing better, but there were some residual things. So I'm going to actually grab something really quick. Okay, so I am back. Fred has magically appeared here, and we're just going to use him as a model just for a second. So back up to speed, saw this patient again at a seminar, another student, and they still had some residual symptoms. And at this point, we were just going through what we were learning at the seminar. We were learning basic muscle testing and how to check and adjust specific muscles in the legs, thighs, inner thighs, and also the importance of the pubic bone. So you can see here on our model Fred, we have our hips, right, pelvis. Your hips, we have our back here, right, tailbone or coccyx. We come to the front, we have this bone down here called the pubic bone, okay? Everyone has one. And as you can see, it actually attaches right to the back. I always like to say your hips kind of form like this big ring, where a lot of times if we have pain back here, it's not only important to adjust and address this, but often we also need to address this point. Now, something interesting a lot of people don't know is you can see this area right here. This is actually cartilage. This is a disc. This is the same kind of material that your disc is made of in your back, right? You've heard of like a slip disc or herniated disc in the back. This is similar, okay? Very similar. In fact, there's supposed to be just enough give here, right? Like when you're walking, that there's just a little bit. Okay, I'm not talking huge amounts. We're talking just enough little give. Now, things can happen, okay, in the pelvis here. I know, probably a weird view, where the pelvis can sometimes get stuck or shift because of this point. These are two different bones coming together. So there are times where one side could shear high and the other side shears low. So it really, really pulls on this. The interesting part to note, now if you pictured Fred having legs here, right? Because this is your leg socket. You have a leg coming down here. Okay, you would have, if you could pretend a leg, or maybe I could actually just stand up. I'll just show you on the model. Right. Okay, here's the model. This is going to be easier. So we can see the pelvic bone that we are talking about in Fred, our model, would be right here. That pubic bone would be down in this area. Now all these muscles on the inside of the thighs attach to that pubic bone, okay? So, perfect. We got our model right here, pubic bone, leg, thigh, all the thigh muscles, right? Think of the inside of the thigh. Okay, so that is the area we're addressing. That was the area we were learning about at this seminar, okay? So, what does that have to do with anything? This individual was still dealing with back pain. This individual was still dealing with problems squatting, and they were plateauing in their performance. Like, even though they were training and conditioning, they weren't necessarily improving or being able to lift more at the time. They kind of were plateauing in their performance. So it was interesting. At the seminar, we were learning how to test and assess those muscles inside the leg, in the thighs that I just showed you, and also assess the pubic bone to see if there's any shifting. Well, when I assessed this patient, we did find that they did have shifting of their pubic bone and pelvis. You know, it was significant enough. And the individual was comfortable with me adjusting them, so we learned a new adjustment. So I adjusted pubic bone at the seminar there under the supervision of doctors, and it was really fascinating. So, you know, I didn't think much of it. It was just learning a new skill at a seminar, went off my way, got busy with school. I didn't see this individual for probably at least a few weeks to a month or so after. Anyways, to make long story short, this individual wound up stopping me one day on campus when they saw me, and they were super, super excited, and they were just thanking me for all my help. And I mean, that's very sweet, but I was like, oh, what are you thanking me for? Like, I'm not sure. So apparently what had happened that we were not aware before the seminar was this individual, very strong, muscle-built individual, the inside of their thighs were not working properly. So I'm going to go back to our chart. So what we had discovered is the inside of their thighs. So this individual had very, very strong thighs. Okay, you think like your quadriceps, right? For thrusting, lifting, powerlifting. These were very strong. What we discovered at the seminar was the muscles on the inside, your adductor muscles, actually were not firing properly. Okay, so those muscles are very important for something like a squat. Okay, just a normal squat, they're important. But you think somebody that's a power lifter and they're lifting how many hundreds of pounds to thrust upwards. What we didn't realize was this individual had a shifted pubic bone. Now, many things that could cause that. That could be an accident, maybe they had a fall, history of car accident. Could be something simpler, just wear and tear over time. Somehow that individual's pubic bone had shifted. And that shifted, that pulled and yanked on the muscles essentially inside their inner thighs, and they were not firing properly. So when this individual was attempting to do a squat, they were trying to squat. Now, when you squat, you should be using all these muscles. Like your main thrusters are coming from the quads, but you still need stability and power coming from the inside as well as the outsides. There was nothing coming from the insides. Okay? So after we adjusted this individual's pubic bone, did muscle testing, got the inside of those thighs working, those adductors working, they said it was different when they went to go squat now. It felt different. Now what happened here is they had a muscle that wasn't working, and our bodies are really good at accommodating. Like it's supposed to be that, say there's supposed to be 5 muscles doing a job, and one muscle just decides it's not gonna work today, injury or something. The other 4 have to pick up the slack for that muscle. So they have to work twice as hard because they're like, not only are they doing their job, but they're doing the job for the 5th guy that's not doing it. So this individual's muscles, he had to work basically twice as hard in his quads to get his lift and his thrust. And so his biomechanics and body position was actually not correct, okay? It was actually wrong. It was off. And we all missed that. After we adjusted the pubic bone, we got those inner thighs working, those adductors working, they now could feel a difference. They actually, for the first time, felt their thighs engaging in a way that they never had before when they went to go thrust. And they had actually discovered that they had some muscular kind of atrophy a little bit on the inside of the thighs because they hadn't been working them. Like they had really strong quads, but the inside of the thighs had not been getting worked. So this individual actually went to the gym and actually started dropping weight. I think they actually probably got picked on in the gym a little bit because they're like, why are you dropping weight? But this individual is smart enough to know that, hey, these muscles are now working, they're firing, they're not up to capacity. So they went back, rehabbed themselves, slowly started adding in weight, really targeted those inner thigh areas, built it up. And now, happy to say, the most important part of this, their back pain was no longer there. Their back pain went away when they would squat and lift, and now they're surpassing all of their previous goals in powerlifting. They passed that plateau because the form was better, the muscles were engaged properly, the pelvis, everything was where it should be biomechanically. So there was no pain now, and performance was way better. So that is why this individual was so excited. And this was one of my first AK cases, so I just found that super fascinating because I wasn't even looking for this. I didn't even know this was like a thing. So anyways, that was an exciting case for me. Sometimes we still see cases like that in clinic. If you have questions about that, please feel free to let me know, and I look forward to talking more and hopefully working with you soon. All right, thank you.